Welcome to the FMP Essentials Show. I am Dr. Yusuf Elyaman, your host, and I am thrilled to have you here with us. Whether you're a seasoned functional medicine practitioner or just starting out on your journey, this show is going to be a go-to resource for mastering functional medicine and making a real impact in your practice and community. Thank you for joining us on the FMP Essentials Show.
Disclaimer: the information presented in this podcast is for educational and entertainment purposes only. It does not constitute medical advice and should not be used to diagnose, treat, cure, or prevent any disease or health condition. Any statements or claims made about specific supplements, nutrients, or other products have not been evaluated by the Food and Drug Administration. Supplements are not intended to diagnose, treat, cure, or prevent any disease. The views and opinions expressed by guests on this podcast are their own and do not necessarily reflect the views of the host or producers. We are not responsible for and do not endorse any statements made by guests. Listening to this podcast does not create a doctor-patient relationship and does not give listeners the right to practice medicine or provide medical advice to others. Only licensed medical professionals can legally practice medicine or provide medical advice. Always consult with a qualified healthcare professional before starting any new diet, exercise program, or supplement regimen, especially if you have a pre-existing medical condition or are taking medications. By listening to this podcast, you agree that you understand and accept this disclaimer. Now get ready to dive in and enjoy the show.
Hey everyone, welcome to the FMP Essentials Show. I am excited to have you here. I am your host, Dr. Yusuf Elyaman. My patients call me Dr. E. And today we are going to take a deep dive into breast cancer. But before that, I would like to remind everyone that in the FMP Essentials, at FMP Essentials, we are all about supporting the practitioner and the functional medicine practitioner, and we believe that every practitioner can be a functional medicine practitioner. Functional medicine is just a root cause approach. And we hope to not only support practitioners, we hope to also give information to those functional medicine champions. And also we hope to give information to people that are interested in what functional medicine is. A non-functional medicine practitioner, we want them to see what functional medicine is about. And we also want to inspire the next generation that are looking for jobs, looking for careers, where we want to inspire them to maybe look at functional medicine. We look at functional medicine or the functional medicine practitioner as a fruit-producing tree. And with that, we are going to go into our first section, which is our clinical topic. And our clinical topic, this is the trunk of the tree. So if the functional medicine practitioner is a tree, the trunk of the tree is really holding things up, and knowledge is really the trunk of the functional medicine practitioner tree. So without further ado, I want to introduce my great friend and colleague and also mentor, Dr. Elizabeth Boham. Dr. Boham, thank you for coming on.
Oh, thank you so much for having me, Dr. Elyaman. It's great to be with you and with all of your listeners and to delve into these functional medicine topics. So fun. Thank you.
Awesome. So let's get right to it. Dr. Boham, give us your 76-second bio.
Okay, are you timing me?
No, do whatever you want.
Okay, but tell me if I'm off. So my undergraduate and graduate degree was in nutrition and exercise physiology. So I'm all about talking about food as medicine. And then I went back to medical school and I'm board certified in family medicine. And then soon after my residency program, I got a job at Canyon Ranch in Lenox, Massachusetts, and that's where I met Mark Hyman and Cindy Geyer and Kathy Swift and Todd Lepine, and that's when I learned about functional medicine. So I am IFMCP certified, and I'm an educator for IFM, and I work at the Ultra Wellness Center in Lenox, Massachusetts as a physician, and I'm the medical director.
Awesome. So I would think that it didn't really take much with that background, exercise physiology, nutrition, that it didn't take much to convince you to jump on board with functional medicine.
I remember going in 2004 to AFMCP, And I literally went up to David Jones afterwards in tears, like tears coming down my face, being just like, this is perfect. This is exactly what I want, to be able to bring together my medical school training as well as my belief in wellness and prevention, and have a map to bring it all together. It was phenomenal. It was exactly what I was looking for.
Yeah,
Because I
and for
was
the
I was kind of frustrated in medical school. I was, was frustrated with the way I was, that the lack of integration in prevention, and this lack of trying to get to the root cause, and the lack of time we were given with patients. So it just was, it was a wonderful gift.
Right, right. And I think I started to get frustrated in practice when I saw it applied. But for you, you had that knowledge. So it makes sense that
Mhm.
earlier on you would see this disconnect. For people that are not aware, IFM is the Institute for Functional Medicine. I'm also a teaching faculty with the Institute for Functional Medicine, and you and I are headed to Europe to be teaching
Woohoo!
AFMCP. AFMCP is like for those practitioners that really just want to get a good, well ground kind of the basics of functional medicine and to be able to start practicing right away. AFMCP is the way to go. So make sure that you take a look at that. So let's get into the questions. So Dr. Boham, tell me, why did you choose the topic of breast cancer to talk about today?
Yeah. So when I was in residency, I was 30 years old and I was in residency, and I ended up getting diagnosed with a triple negative breast cancer. So even though I was all about wellness and prevention and I was eating healthy and exercising, all of a sudden I was actually doing breast self exams because I was trying, not because I had no family history of breast cancer. I wasn't worried I was going to get breast cancer, but I was trying to figure out how to do breast exams on my patients. So I was practicing on myself. And so every month I would do my breast self exam. And in July of 1999, it felt fine to me. Everything felt normal. And when I did my breast exam in August of 1999, I found a lump. And I was like, well, that's weird. And, my husband was like, you should get that checked out. Well, I did. And luckily, I was in the medical system, and I had just done a rotation with a breast surgeon. And I was really lucky with how fast we moved because, triple negative breast cancers are often pretty darn aggressive. Um, but because of my age and my and the aggressiveness of the cancer, I did go through surgery, and then I had chemotherapy, and then radiation therapy, and then I got through the other side. And well, I really wanted to have kids, so I had kids. That's a whole nother story. But then when I really got through the other side, right after, I was all of a sudden, I was like, oh my goodness, what did I just go through? I just had this aggressive, life-threatening illness, and I thought I was all healthy. I was like, real thought I was taking good care of myself. And what happened? What did I do wrong? How can I prevent this from coming back? How can I prevent this from how can I help my patients prevent cancer and breast cancer? And really, what can I do to keep myself healthy? And that's when I was really lucky to learn about functional medicine. As I said, it was like this aha, right, where it brought it all together. And I could say there's other things I have to pay attention to in terms of prevention, as well as understanding all the different systems in my body that are out of balance. And so, so that was 25 years ago when I went through treatment. But it's been really fun for me to teach people about functional medicine in the community and at, the general population, while using this breast cancer lens, right? Because it's a passion of mine, and just understanding how all the different systems in the body impact risk of cancer and breast cancer, and how lifestyle factors influence those. But also, it's a way that women can feel, mostly women. I know men get breast cancer; it's just very rare. But you can help women become motivated to make some shifts in their life that can not only help them decrease their risk of breast cancer or reoccurrence, but also decrease risk of all other illnesses, or especially heart disease and dementia, right? So when you're creating that terrain in somebody's body, that's less likely to grow cancer, you're also decreasing the risk of heart disease and dementia and other illnesses as well. So it's really been this way that I've been like, okay, let's using, my history and my passion to get the message out about how to think about the health of the body differently and apply that functional medicine approach. So I speak a lot about the functional medicine approach to breast wellness.
Yeah, and I can't think of a better person to talk about it. I'm very happy that to have you today speaking about it because you have that firsthand experience. And the eye-opening thing for me is that you're saying that it's not like you were not unhealthy. You were healthy. You were eating healthy. You were exercising. I just had a meeting with my health educators. We have health coaches here at the office, and we're about to do what we call a 28-day cleanse, where we go on a kind of a functional medicine support to get rid of toxins and chemicals. And we were talking about how the rise of breast cancer in particular, how it significantly rose after DDT came out and after all these chemicals started coming out. So part of it, would you say that a lot of do you think that if you lived, let's say, 300 years ago, do you think you would have gotten breast cancer?
No.
It's it so
No, so I remember when I went through treatment, there was like a few other women who were 30, but I was an oddball. Like I was like, it was really rare to be 30 and going through treatment in 1999, right? That was not common. And there was nobody younger than me. And unfortunately, now we see a lot of 20-year-olds getting diagnosed with breast cancer. And and I of course, the microbiome is impacting things and our lifestyle is impacting things. But I think that toxins are probably the number one area, especially when we're talking about that younger woman, and especially women when it's not driven by insulin resistance or alcohol, right? I think all of those environmental toxins are huge. And what's really tricky, I did this lecture on with the Health and Human Services the um, with the government over last summer regarding these endocrine disrupting chemicals. And what's really tricky when you look at the literature, right, is that timing of exposure is so critical, and it's not always around the time of diagnosis, right? So sometimes women are exposed in utero or in early life or in puberty to some of these endocrine disrupting chemicals, such as the plastics, the BPA, right, the phthalates, the DDT, the DDE, right, the pesticides and herbicides, and 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 then it can change a woman's breast tissue in a way that makes her more at risk for getting breast cancer 50 years later or 20 years later or whatever. And unfortunately, there's not this linear relationship with these endocrine disrupting chemicals either, which means that sometimes a small exposure at a very critical age can have a big impact, which is unfortunate. So yes, I think toxins are it's where I pretty much always focus it when you do all the testing, because people come in to see me in my practice. They want lots of testing, and we'll dive deep. And there is a lot of areas we focus on, but supporting the body's natural detoxification capacity and working to lower somebody's toxic load is huge. It's really a huge area.
right. And I think like you said, that since toxins do play a huge role, but your microbiome helps you with toxicity. So if the microbiome's off, that can throw things off too. And toxins may change DNA, which can lead to cancer. But then our body, if the immune system's strong, it can fight against cancer, like it can take care of it. So that's where I think functional medicine is so needed, to not stop thinking of things linear as you have breast cancer, this is the treatment. You have diabetes, this is the treatment, and look at that individual balance. Because one person might have one thing leading to breast cancer, and the other may have another, and the other may have like four or five things. So Elizabeth, how old were you? Said you were 30 when you were diagnosed?
Yeah.
what was happening in your life? You said you were you, did you say it was in med school? Were you in med
I
school
was in
or
residency and
residency?
I was working in the ICU and I was working nights, a lot of nights. And so obviously, my immune system wasn't working as good as it could be because of just the amount of hours I was working and that. But also my I struggled in medical school because I came from this place of I want to focus on prevention, right? And then of course I get a disease, which is very interesting, but that's a whole nother subject. But I came from this place of I want to focus on prevention. And then I had no physicians in my family. Every doctor in my family is a PhD. So I had no idea what training was going to be like. And then all of a sudden I'm doing all this acute care medicine and in the ICU and I had a lot of, my mindset was not in the right place, right? So I had a lot of anger. I was frustrated with my decision. I thought I made the wrong choice. I was fighting it. I fought it the whole way, right? And so that also was not good for my immune system, right? Like I wasn't coming from it from a healthy perspective. And there was a lot of that my stress, the way I was dealing with my stress, my mental emotional well-being was not good, right? So there, I think that really that and lack of sleep, it was all wearing down on my immune system as well. Absolutely.
The perfect storm. So
Yeah.
you are kind of trying to become a better clinician. You're examining yourself. You feel a mass. When you first felt the mass, what went through your head? What did you think was happening?
I just thought I had a lump. I thought my breast was lumpy, it was like cyclical but it was very different than that. But like that was where my head went to
Yeah.
total place of denial. I definitely didn't think it was an issue. And as I said, my husband really encouraged me, and I was lucky that I was with a bunch of attendings, right? I was in residency and they did an exam and they sent me right to the breast surgeon. Everybody moved way faster than I did.
Yeah.
I went into I can remember speaking to the resident who was on the case with my surgeon who removed the cancer and saying to her afterwards, because my surgeon was very nice to me and said, well, maybe it could be a fibroadenoma. I know you want to get pregnant. We should remove it anyway. So that's kind of how because the biopsy was inconclusive. That's kind of how she said it to me, being gentle, I think. And I can remember after the surgery saying to the resident, I think it's just a fibroadenoma, da da da. And I could, now I look back at it. I mean, they knew in the surgery that they knew right away that it was an aggressive cancer, unfortunately. So yes, I went through a lot of anger and denial. And, it took a while for that to sort of shift.
Yeah, let's go back to so now they're still saying fibroadenoma. They go in, they do the surgery, and the biopsy comes back. What did they said you needed chemo and radiation?
So the my surgeon, was saying, well, maybe, could be a fibroadenoma, but whatever it is, we should, because they had done a needle biopsy beforehand, but she said we should remove the cancer, we should remove the tumor. And
Mhm.
so, but once she removed it, they knew it was an aggressive cancer and it was diagnosed as a triple negative right away, which is, and triple negative breast cancers do better with chemotherapy than like the ER/PR breast cancers. And so yes, the recommendation at that time, and which is still the same recommendation today, was chemotherapy. And I did it.
So take yourself back to when you first find out that you not only have cancer, but you also have to go through chemo and radiation. How did you feel?
I was angry. I was sad. I was scared. But your body just kicks in. But the biggest thing, my focus went to, I want to have children. And I had worked for WIC, Women, Infants, and Children, prior to going to medical school. So I was all about breastfeeding and having kids, right? That was like such a huge focus for me. And so that's kind of what I really focused on.
And
And
did your mind go to, I'm gonna fight this thing. I'm gonna like, was your mindset, you were angry, which sometimes you can rechannel that. That can, it's not always bad to be angry, right?
Right.
But was your eye, some people get breast cancer and think, oh my God, I'm going to die. That's it. And some people are kind of, they don't know what to think. They go to freeze. And then some people are like, you know what? I'm going to roll up my sleeves and do what I have to do. I'm going to fight this thing. Would you say,
Yeah.
what was your attitude?
Well, yeah, I would guess I was like, okay, I'm gonna fight this thing. But also I found it, I also thought in my brain went to they took out the cancer, right? So it was 1.7 centimeters. My nodes were negative. Back then they weren't doing well, they were just starting to do sentinel nodes. So she took out 8 nodes, 8 lymph nodes, which were all negative. And in my brain, even though now I know this is not true, at my brain, I was like, this was removed. I am cancer free. And so I questioned my oncologist and my radiation oncologist. I did a lot of questioning, like, I don't really need to do this, right?
Hmm.
But I did, but I also was like, okay, I'm going to use whatever other modalities. And so I hadn't heard about functional medicine yet, right? But I was going to use whatever other modalities I could do to support my body. And so I did a lot of things like acupuncture, and that was so helpful for helping me through the treatment and calming down my body. My mom gave me a session of Reiki every week for like a year, and that was life changing. The woman who did Reiki with me changed my life. Like I can't even explain it. Helped with all the symptom management, but also helped me learn how to trust my body again, and just help my body calm down more. And I did a lot of journaling, and I learned about the chakras and meditation, and I started to do gratitude journaling, which really was helpful at changing that mindset, because that mindset was, I was definitely that like glass half full kind of mindset. And I started to do some gratitude journaling. And over time, that really helped shift my mindset for me. And I was like, not only did I want to fight this, but I wanted to have kids. So I was like, I want to have kids. And so when I finished the radiation, the chemo and then the radiation, um, I was pregnant. My daughter is going to turn 24 on Sunday, like in 2 days. So we got pregnant pretty soon. Like of course, with the chemo, I lost my period, I lost my hair, I lost my period, I went through menopause kind of symptoms, and then, but then pretty soon after treatment, almost too soon, my oncologist was not happy. 5 months after treatment, we were pregnant with my daughter. Not sure if I would recommend it, but then, but I did it, and then was able to breastfeed on the non-radiated breast. And then a few months, 22 months after she was born, my son was born. And I was, that was became my focus. Like, I'm gonna fight to get through this so I can have kids and I can raise my kids. And so I think that's kind of where my mindset went.
Yeah, and that focus could have saved your life. I know when we have people that get diagnosed with breast cancer, the first thing that we do is we let them know and this is actually what I tell patients. I tell patients that you can, if you have two people with exactly the same cancer, I'm sorry, exactly the same type of cancer, one of the big factors on who's going to do better and who's going to have a better outcome is going to be the people with a better attitude. So if they say, I'm going to fight this thing, I'm going to beat this thing, they are going to do way better than someone that says, oh my God, I have cancer, I'm going to die. Why has this happened to me? Like, so
True.
what I usually tell them is you feel, go ahead and feel the emotions that come up, because you don't want to just stuff the emotions down. They'll come up later in other areas. Maybe when you're with your family in different scenarios, they have to come up at some point. But feel the emotions without trying to fix it, and then start shifting the mindset, and have that, we are going to take care of the we're going to go get them. And that's why for me, in working with people that have cancer, and I'm sure it's the same for you, is mindset kind of help them with that mindset. And the people, I'm sure people are going to be watching this show. Some people are just going to, maybe they were just diagnosed with breast cancer or a type of cancer. And I hope that this is one piece that they can pick up, that mindset is so important to healing. Now, if we can get into, actually, I got one more question. I love, I know we got to get into the biochemistry stuff too, but I have a question. If you reflect back on your journey and you're getting breast cancer, your chemo, and your radiation, how has that changed you as a physician, and how has that changed you as a person, as a mother, as a daughter, as a wife?
Um, well, yeah, it's changed me in so many ways. Almost like it's hard to even list them all. But I would say the first is just the experience of gratitude that I started to practice during that time. And I got to tell you, I was not when I first started, I was pissed off and angry. I wasn't feeling grateful, but just practicing that every day really helped my mind shift. And so I am a much more glass half full personality now, right? And I see that more easily, and I can see like it's almost interesting. Like I'll be walking around going, "Oh, look how beautiful that tree is," and that is different than how I was before,
Yeah.
and it's fun, and it just makes life more joyful, and it really helps me in so many ways. So I that is was a wonderful shift for me. And as a physician, it was so life-changing because, as you can imagine, I had some physicians when I was going through treatment that were amazing. Like they could see me, they heard me, they listened to me, they made changes based on what my needs were. And then I had some that really couldn't, they had their protocol in place and they couldn't really shift in their mind until I walked out crying and then canceling my radiation therapy. You know what I mean? So it was just this very interesting process of being the patient so much. Like I had so many doctors, and then there was obviously complications from all of this. And over the years, I've had other weird things happen because of probably connected to all this. So I've had so many doctors. And, and so it's really taught me so much about how I want to try to practice medicine and and that has been really, really a gift as well.
Awesome, awesome. So just a couple of thoughts. So when we get that trigger, and in your case, shoot, I have breast cancer. Our animal brain goes into the fight, flight, or freeze because we're trying to fix it. So fighting because our Stone Age ancestors, when they were triggered, they needed to fight, they needed to run away, they needed to, and people run away different ways. They can go to drugs, they can go to all the different types of addictions, and then freezing up, where if you when we if you think about mammals, if they or reptiles, if you think of animals and our Stone Age humans, if there is this overwhelming force over them, sometimes just playing possum or playing dead can save them. And that's where and then and the brain goes to trying to fix the problem. And a lot of times when it comes to the feelings, we want to just feel the feelings without trying to fix it and then move forward. And it's interesting, the guest house poem, the poem, I work part-time at the guest house, which is a trauma and substance abuse center. And it's called the guest house because of Rumi's poem, The Guest House. And it talks about how all these emotions are honored guests and how you invite them in. And gratitude is a big piece. Meet them at the door laughing, all these different emotions, and be grateful for whatever comes because each has been sent as a gift from beyond.
Mhm.
So the other point that came to mind is that you said now you're a glass half full and a glass half versus a glass half empty. To those people that are trying to support others when they come up with this diagnosis or when they come up with scary news, trying to go and tell them, hey, be grateful, there's good in this, might not always be the best way of approaching it. How would you know how you were back then? And it sounds like you were listened to and you were guided kind of in that to that mindset of gratitude, right? What advice would you give people on if you see that there's somebody that you know that they could be grateful or there are things to be grateful for, but you don't want to say things to kind of trigger them and get that response. What advice would you give to people? And it doesn't have to be about gratitude. How would you advise them to support maybe a loved one or a patient that just got the diagnosis of cancer?
Yeah, so it is, I think the thing I learned the most is say less, right? So because as physicians we want to fix something, right? That's our initial reaction. And so sometimes when we talk too much or too quickly, we sometimes say the wrong thing. And so for, what I try to do is I try to say less and then just be there to listen and hear and try to get a sense of where somebody is and understand when if they're still at this, if they're really struggling with that anger and not feeling very grateful. I mean, I will sometimes, if it's the right time, gently recommend, maybe have you tried journaling or some books that I think are really helpful. Pima Children's, like When Things Fall Apart, or Return to Wholeness by David Simon, who used to work with Deepak Chopra. Some of these things that just helped me reframe it in my mind. So I might recommend some books or journaling. But you do have to be a little careful, because if you just say, well, oh, you're lucky, this is, it doesn't always go over well.
Right.
You know?
I love that. The say less. So I went through, so I'm psychological trauma certified. I went through 5 modules through spirit to spirit of learning. They actually, I thought I would be like taking a lot of notes. No, you're sitting and doing your own trauma work. And I thought I had no trauma until I did this. And I'm like, oh shoot, maybe I got some, maybe I was wrong. But
Uh-huh.
one of the biggest things that I think has really been a game changer for me as a practitioner, um, is is the whole say less. As an extrovert, my nature is to kind of speak first. And once I started to get comfortable with silence, because a lot of it was I wasn't comfortable with silence, I noticed that I was more effective around people. And then I think the second thing is that we are practitioners and people come to us and they're asking us for help and advice. And
Mhm.
that's very different when you're around your family members, because I'd always get upset, like, why is it that I know all this stuff? People come to listen to me teach other providers how to do this. Why are they not listening to me? So I have to keep reminding myself that stop giving unsolicited advice. If
Mhm.
people are asking you, it's very different than you going and saying, "Hey, you need to be grateful." But no, thank you, Dr. Boham, for that. Now let's get into breast cancer and let's get into the diagnosis. How do you make the diagnosis of breast cancer?
Right. So, I mean, the traditional recommendation, right, for early detection is mammography every other year between the ages of 40 and 74, right? So, but I also think that clinical breast exam every year is really important. And I do teach women how to do, or encourage women to do, self breast exam, because, we can find breast cancer early, and the earlier we find it, the better the outcome. So that's great. But we have to remember that all we're talking about here is early detection and not prevention, right? So we'll talk more about prevention and creating that terrain where cancer can't grow in a little bit. Um, for women with dense breasts, we're doing ultrasound on top of it, or younger women, ultrasound is good. And I think in the future, there's a lot of excitement about a new ultrasound device called QT imaging, which is an ultrasound device where it's not dependent on the technician. You just lay on a table. There's no compression of breast tissue. There's no radiation. And so I'm hopeful that something like that, if not that, will be be more available for our younger women and women with dense breasts, because as most people know, mammography is better for the older, less dense breast, and it does have radiation
Right.
involved with it. So we do want to be cautious about how often we're doing it, or how much of it somebody gets in their lifetime.
And radiation
Mm.
can cause breast cancer, right? So we're and I'm not knocking it. I have patients that will not get a mammogram. They will, and they
Yep.
go to these fibro scans. And I've seen people that they're refusing the mammogram. They feel a lump. They get a fibro scan. The fibro scan is normal. I convince them to do a mammogram. It's positive, and they end up having cancer. Have you seen that?
Yes, yes. I mean, and it can go both ways, right? So something, some cancers are picked up more on mammography, some on ultrasound, and then of course there's MRI for those high risk women. But MRI they're not easy to do either for screening because it's a long test with gadolinium, and
No, no,
so
I'm talking about fibro scans. You know, the fibro
yeah.
scans, the heat
Yes.
kind of wave. Is that something that you do or you
Like
recommend?
thermography.
Thermography, yes.
Yes.
No, I called it a fiber scan. I'm sorry. I'm stuck with fatty liver. No, thermography. So I take that back. So people will do thermography, and with the
Yes.
thermography, it'll show that they'll do that instead of doing the breast or
Mammogram.
the mammogram, and the
Yeah.
thermography is normal, but then the mammogram shows that they have breast cancer.
I mean, thermography is not perfect. It is unfortunately not going to be the screening test of the future. It's got some positives. It's looking for heat, and it can find some abnormalities sometimes, but it's not good enough, unfortunately. So that's why I was saying there are these other things maybe coming down the pike that will be an alternative I'm hopeful for.
Yeah, so I'm interested in this QT imaging. Is this something that people could go pay self-pay and get them done?
Yes, but there's just not a lot right now. There's
Okay.
not a lot of, there's like I know like in Arizona and California, there's a couple places. I've been looking for some on the East Coast, and we're hopeful that they'll be more available.
Yeah.
Again, especially for that younger woman, the denser breast woman, but maybe even in the long run for more people.
No, I can't wait because we said that you're getting radiation to see if you have breast cancer, which radiation may increase the risk. So I know it the numbers like in the thousands. We could put this, I don't know the statistics, but for every tens of thousands of mammograms, you actually will cause a certain amount. I have to look at those numbers. I don't know if you
No,
know.
and it's interesting, and especially for women who are BRCA positive, because the BRCA gene, if they have a variation in their BRCA gene, of course they have a much higher rate of breast cancer. But the reason is the BRCA gene helps to fix damaged DNA. And so for women with that variation in their BRCA gene, they have more damage potentially from mammography, actually. So when you've got a strong family history or a family history with the BRCA gene in it, we just need better screening for those women, because it doesn't make sense to start mammography at such a young age, because first it's not that great for young women, and then you're just going to have that accumulation over the years.
Yeah, more exposure over the years. So yeah,
Yeah.
no, I'm excited. I mean, till then, we have what we have. We have that we're
Yep.
there's there we follow the guidelines. It's the best we got, but hopefully
Yep.
there are better things in the pipeline. I can't wait for that. And then so now they get a image, and the image is suspicious, and then the next step would be what in the diagnosis.
Yeah, so they do a needle biopsy, and then depending on that, then they'll do a lumpectomy, or if the needle biopsy is conclusive, then they may start treatment right away, depending on what the outcome is.
And they'll do lymph nodes. They'll look at lymph nodes, correct?
Yeah, I mean, that's there's some shift in that area about how much they need to do, and that really depends on the situation at this
Okay.
point. But yeah.
And then,
Because I think what we're learning, and like this is again when I was saying earlier, what I thought, like I was like, my lymph nodes are all negative. You removed the cancer. I am cancer free. But probably at that point, I did have some cancer cells floating around in my body, just to feel like it just, my mind, I was like, it was just right there. But we know that, that's not the case. And that is essentially why, of course, they recommended the chemotherapy at that time.
okay. You mentioned that you were triple negative. So can you explain what is triple negative and what are we looking at, positive or negative?
Yeah. So when the tissue goes to the pathologist, they look to see at the cells, the breast cells, if they have the normal amount of estrogen and progesterone receptors on them, or if they have this excessive amount of estrogen and progesterone receptors on them, and or do they have these HER2 receptors? And so for me, I had it was, triple negative is a very poorly differentiated cancer, and it didn't have excessive amounts of estrogen or progesterone receptors on it. So they call it a triple negative. And that really, the delineation is just to help us know what the best treatment is. And then with women who are ER, PR positive, that will result in some of the medications like tamoxifen, or depending on their age, an aromatase inhibitor. And then the HER2 also will cause a different medication being used. So it's really just a way of understanding the cancer. But what's interesting, and I've thought about this a lot over the years, even though mine was triple negative, it didn't mean that hormones weren't influencing my risk. And so, with women who are triple negative, I still think about things like the xenoestrogens, those toxins from the environment, and how they can impact our risk of cancer. I still think about estrogen metabolism. I still think about things like the microbiome and how we're mobilizing our estrogen and beta-glucuronidase and that whole piece. I am still thinking about that because we do know there's still that there's still an influence there.
Right. Just because it doesn't have those particular receptors, it actually tells you that it looks very different, like it's very different than breast tissue, right? It's morphed so much it doesn't have these three receptors, but the, like you said, the xenoestrogens or like the toxins that are like estrogen, and even
Yeah,
I
and
would imagine.
from what I know from pathologists, it still has those receptors. It just doesn't have this hyper expression of those receptors that like an
Okay.
ER positive would have. And so that those have this extra amount of receptors that make them that they shift it in a way to have more than the normal amount of receptors that makes it so that the medication to lower hormones in your body are really effective for those types of cancer.
Okay. So now you have somebody, they're diagnosed with cancer, with breast cancer, and now let's say you are the primary care practitioner. You could be the health coach that's working with them. You could be nurse practitioner, PA, naturopath, whatever it is. Their job isn't over, is it?
No, exactly. And that's like, that's a great place for us to really support as functional medicine providers. We can provide a lot of support for these women, both to give them hope and give them some things to focus on, as well as to help them create this terrain in their body where the cancer is less likely to grow, where they're more likely to respond well to whatever treatment they're going through, and have a less chance of recurrence. Or so there's a lot we can do. And I think this is really where functional medicine shines. And that's where you pull out your matrix, right? And you think about, when you're gathering all that information from that patient, you're thinking about what their antecedents were, what their triggers may have been, where they need to focus in terms of their lifestyle factors. So personalize where they need to focus in terms of their lifestyle factors, and then focus on what may be out of balance in the systems in their body, and really come up with a personalized approach to help them create this healthier terrain.
So somebody comes to you and they have a family member that was diagnosed with breast cancer. Or they come to you and they were diagnosed with breast cancer. What blood work, what extra tests would you do that's kind of beyond what a conventional approach would be?
Absolutely. So the first thing I focus on is I look for signs of insulin resistance because
Okay.
we know that prediabetes, insulin resistance, metabolic syndrome, whatever we want to call it, right? The research here is very deep to show that that encourages breast cancer and encourages the growth of breast cancer. So the
Mm.
first thing we want to do is look to get a sense of, by looking at their waist to hip ratio, by looking at their insulin, fasting blood sugar, hemoglobin A1C, their lipid panel, even particle size testing. You want to get a sense of, does this person have insulin resistance? And if so, what can we do, of course, to reverse that and improve their insulin sensitivity? And what can we do to lower their insulin in their body and keep their blood sugar stable? Because that will help with their morbidity and mortality. And then the second thing I look at is inflammation, right? I'm
Well,
looking.
can we go back? Let's go back to insulin resistance.
Yeah.
So, from an insulin resistance point of view, basically that means that there are certain cells, like fat cells in the body, that they can become resistant to the effect of insulin. And insulin's job is to help drive sugar into certain cells because certain cells don't need insulin. And insulin kind of works like a growth hormone, right? And if you have insulin resistance, it leads to, like you mentioned, inflammation and oxidative stress and whatnot. But back to the insulin resistance, I think one of the scary things about insulin resistance is that there was a study looking at young males that were not overweight, and they did an insulin resistance score on them, which is even deeper than just looking at insulin. And they found that around 40% of them were insulin resistant. So, and they were younger, and they were not overweight. They were normal weight. So back to the insulin resistance, when now your body starts needing more and more insulin to get the same job done, and that insulin can affect other parts of the body. Is that kind of how you understand it?
100%.
So do you ever do like an insulin resistance score, like a C
Yeah.
peptide,
Yeah,
is
like so
that
you're
part of
saying
your
like the
training?
HOMA IR score
Home IR, yep.
where you calculate based on fasting blood sugar and insulin? Absolutely. And I check fasting insulin all the time with my patients. And I also find that things like the waist to hip ratio, and we are using BIA technology with the in-body right now. So getting a sense of body composition is also really helpful, and looking to see how much visceral adiposity or fat around the belly somebody is carrying. That can also help me understand what level of insulin resistance somebody has. But you're
So,
right,
so
because yeah,
no, good point. So the fat around the belly versus, so tell me, what's the difference? So fat's not just fat. It depends on where it's at.
it depends on where it's at, right? We
Yeah.
know the fat in the viscera around the organs in the belly is more inflammatory. It's creating more inflammation in the body, and it's tied to more insulin resistance. And so that's a great way to look to see, what level of insulin resistance are you dealing with this person?
Yeah, no, so I'm glad you mentioned the bioimpedance testing, bioelectrical impedance testing. And for people that don't know, that's actually the technology has been around for a long time. It's kind of like an EKG, depending on the device, and you are sending a current from the top of the body to the bottom, from the hands to the feet, or the arms to the legs. And based on that, it can help you figure out percent fat, percent muscle, if there's water that's just kind of floating around out of the cells that doesn't need to be there, that's actually not a good thing. But what I also love about the bioelectrical impedance is it can check a phase angle. And the phase angle is one of those, it has to do with how the body repels electricity. And the higher your phase angle, the healthier you are. And there's data showing that people with higher phase angles have better outcomes with things like cancer and AIDS and other chronic diseases. So I'm always, so when we have somebody with cancer, we're encouraging them to do this BIA, not only to, we want to up their muscle because if their muscles are, if they have less muscle, they may, sometimes can get some muscle wasting, which is not a good thing during
Yep.
their treatment. But also we want to see that phase angle. Are you looking at a phase angle with your patients?
We used to with our old bioelectrical impedance device, but with our new one, we don't get one,
That's why I
unfortunately.
didn't buy the InBody yet, because I
Yeah.
think the newer one has it, but I really like the phase angle because I really like,
Yeah.
but either way, you're getting really good data from it.
Yeah,
So,
and then body composition can give you a lot of clues as to how much you need to focus with this patient. So then if I feel like there's signs of insulin resistance, then that's an area we really focus on because the data is really strong there in terms of when you improve insulin sensitivity, when you lower that inflammation in the body, that the people do better.
so we talked about getting a bioelectrical impedance. We talked about you could potentially, some of them will do this thing called a phase angle that you want high. We talked about the first thing you went to was insulin resistance, which is interesting. So they say that that Alzheimer's they want to call diabetes type 3 and maybe breast cancer is diabetes type 4, right?
Right?
So
Yes.
I just wanted to add, we check a C peptide with our insulin because when insulin is released from the pancreas, there's insulin plus C-peptide together. The C-peptide is cleaved off and the C-peptide lasts longer. And that way, sometimes that insulin goes down faster, but if that's high, that indicates insulin resistance. And then Quest Diagnostics has this proprietary insulin resistance score that they look at these other markers that you can kind of look at. So depending, I guess, on what lab you as a practitioner out there are using, but we definitely want to look at insulin resistance. What's the second thing that we want to look at? I think you mentioned inflammation.
Inflammation, 100%. Because
Okay.
we know that cancer uh, likes to grow when there's inflammation around, right? So I'm always thinking about not just that cancer cell, but the terrain, all the tissue and cells around the cancer that influence whether cancer grows or doesn't grow. So, we're measuring for signs of inflammation, right, by using things like a CRP or a SED rate. We're looking for anything that may be triggering inflammation in that person. So this is very personal, right? Because you're
Yeah.
that person, you're like, okay, do they have high inflammation? Could it be from insulin resistance? Or maybe it's from dysbiosis or their microbiome being out of balance. And we really, or their gum health, or they have some chronic infection in their body they haven't dealt with. So that we've got to kind of tease out and work to remove so that their immune system can work better.
So you look at, so you mentioned CRP, and I know a lot of us are looking at the high sensitivity CRP, right? So
Absolutely.
it's looking for the microscopic inflammation. And if it's high, then you said what you do is then you look at gut health and you see if maybe the gut is causing it, right?
Hmm.
What other imbalances, what other things are you going to be looking at? What
So,
other tests are you going to do?
yep. So, are we talking about just inflammation, or do you want to go beyond that?
No, let's go beyond. Do you check anything else beyond high sensitivity CRP as your major marker of chronic inflammation? Are you checking other things?
It depends on what else this person has going on. So like if they're also coming to see me with concerns around vascular health, I may do some of those other markers, that can give us a sense of their vascular health as well. So anything from like LPPLA2 and oxidized LDL, and of course we may do a SED rate if there's, if any autoimmunity going on. But
Right.
then I'm looking at what's going on in terms of their microbiome, and not just their gut microbiome, but is there any dysbiosis in the oral cavity or on the skin, or, where else do we need to work to
So,
to
so
rebalance?
let's talk about oral microbiome. How are you assessing the oral microbiome?
So we're using a DNA marker. We're using a company that just, does a swab of the mouth and gets a sense of the bugs in the mouth and how much are more of the pro-inflammatory bacteria versus the not the more less pro-inflammatory.
Now, you don't own this company, right? You have no vested
Nope.
interest. Which
Nope.
company are you using?
Well, we're using either My Periopath or Bristol Health. Those are the two companies we've been using lately.
Okay. And then how do you assess the gut microbiome?
So we'll do stool testing, and we'll do stool testing.
And you'll look at the different bacteria that are kind of found in
Yep.
there. Okay. What other tests do you do?
So a lot, when we're talking about breast cancer, especially, we're thinking about in the stool test, do we see that high level of beta-glucuronidase? Because we know that beta-glucuronidase will, if it's high in the stool, what it will do is it will cleave estrogen that's bound to glucuronic acid that was on its way out, right? Was going to get released in the stool after it's done its job. And it's a means of detoxification. But if beta glucuronidase is high, that'll get cleaved, and then estrogen can get reabsorbed in the body and other toxins as well. So,
So,
so
so can you say that again? So what with beta glucuronidase being high, what gets cleaved?
this estrogen glucuronic acid combination that
Okay.
has happened after the estrogen has done its job, it gets bound to glucuronic acid, and that gets released in the stool and then would get pooped out, right? But if the enzyme is high, that will get cleaved, and then that estrogen can get reabsorbed into the body.
Okay. So one of the big things in the stool is seeing if they have high beta glucuronidase, because if it's high, that means then they have more reabsorbed estrogen, which just like
Exactly.
insulin, you don't want too much insulin or estrogen floating around. Um,
Exactly. So
okay.
that can also give you an indication about dysbiosis, right? Because one of the things we know that creates more beta glucuronidase is more dysbiosis, right? So that would say, okay, we've got to work to rebalance the microbiome with a high fiber diet, or maybe some treatment of that, or even use something called calcium deglucarate to bind to those estrogens and toxins to help lower it in the interim.
Okay,
So
what other tests? Somebody comes to you, they have breast cancer or they want to prevent breast cancer. What other tests are you going to do kind of off the bat?
yeah, so sometimes we'll look at estrogen metabolism. So, right now we're using the urine test for estrogen metabolism, looking at, how somebody's breaking down their estrogen into the different forms, because we know that some forms of estrogen, the 4-hydroxy estrone, is potentially more carcinogenic, and so we're looking at that ratio, and so we will do that. We often look at different toxins, though I find toxin testing frustrating. But we will look at everything from heavy metals to, sometimes plastics and parabens, though I need a better company there. And look at if depending on how much testing somebody wants to do, we may look at things like oxidative stress, and that will give you a sense of how well somebody is detoxifying. And we might even look at some of their genetic SNPs or variations in their genes that can be influencing how somebody metabolizes their estrogen, as well as, how much methylation support they need. So those are some of the major things we'll look at.
So sometimes you'll be looking at those genetic markers as well. I know for oxidative stress, I mean, I remember going through residency, med school and residency, that GGT test was just, to me, it was just a liver enzyme. And now I became aware that it's a byproduct of glutathione, which tells you they had oxidative stress. And we check the F2 isoprostanes in the urine. Is that something that you're looking at, or
I
that's
yeah,
more for cardiometabolic, but
yeah, though,
yeah.
yeah, one of our panels does that.
Yeah.
And and then I also will look at the 8-hydroxydeoxyguanosine, which looks at oxidative stress that has damaged DNA. And then, of course, oxidized LDL, another cardiovascular risk factor, but can give you a sense too of oxidative stress.
Where do you get those tests at?
So the 8-hydroxydeoxyguanosine I get on the NutriEval by Genova,
Okay.
typically, and then the oxidized LDL through Cleveland Heart.
Okay.
Yep.
Nice. Is there any other testing that we kind of left out for the evaluating breast cancer imbalances?
I mean, I look at vitamin D, of course,
Okay.
and I do sometimes do a serum zinc and serum copper just to get a sense of do they need extra zinc for their immune system, or is there a lot of inflammation driving that copper up? So I will do that. I will look at some methylating markers, markers that tell me about how they're methylating, like a homocysteine. Um, those are some of my
You know what? You know what's pretty cool?
ones.
I'm thinking. So we've had quite a few guests now, and what I love. People get overwhelmed about functional medicine, and they're like, "It's just so hard." And how do you remember all this? And I remember when I was looking at you guys, like you were one of my functional medicine teachers when I first started, and thinking, "How the heck do they learn it?" But I just want to give encouragement to people at home that it the body only has a certain amount of ways it can mess up. And that's why the panel for cardiometabolic disease is very similar to a panel that you look at for breast cancer, which is similar to Alzheimer's, which is similar to fatty liver. So once you figure out, like Dr. Boham said, the matrix, basically looking at the different imbalances that cause disease. Once we understand how the body works, we just know that genetically one person will get breast cancer, another person with the same imbalance will end up with Alzheimer's, and one person something else. I just wanted to point that out. I think it's kind of cool though that once you know the ways that the body can go off and ways of evaluating it, it can kind of help every organ, right?
100%, 100%. You just summed it up beautifully. And it's true, like if you get lost in your patient's story, like it seems overwhelming and too much, just sort of look at your matrix and say, okay, where do I need to focus for this person, and pick one area or two areas, right? One area like inflammation, and another area like in the lifestyle area, so you don't feel so lost and overwhelmed.
Okay, good. I think that's a great evaluation. I think for those of you also at home that aren't doing all these, just start looking at one at a time. Listen to this a couple of times and start. You don't have to add all of them at once, right? Now let's talk about how do you treat it? We have about 4 to 5 minutes for this.
Okay.
Where do you even start?
Yeah. So again, I think you have to personalize it to your patient. And so I'll just use me for an example. Like if we went to my lifestyle factors, my nutrition and exercise was really good. I did need to work on sleep, but that was a little beyond my control, though. Of course, I took a break from residency and could get some more sleep. But I really needed to practice. I really needed to work on that stress section, right, of the lifestyle factors. I really needed to work on my stress management. So if I was taking care of me 25 years ago, right, we would have talked about how can you add in some things every day to help calm down your body and activate that parasympathetic nervous system, and so really personalize those lifestyle factors for the patient. For somebody else, it may be from a diet perspective, they may really have needed to do something like the detox food plan, right? Or really balancing their blood sugar, or pulling out all those carbs and refined sugars and carbs. And
And,
then,
and let's talk about the detox food plan because a lot of fads are out there they call them a detox,
oh yeah.
and a lot of times all they do is make you poop, which helps detox, by the way. But I think for us in functional medicine, when we say detox, we want to help our toxins need to be transformed before we can get them out of our system. So we have our patients eat foods that are low in toxins in the first place and low allergenic. And then they also we give them foods and supplements that help the liver transform them so the body can get rid of them. Does that sound, do you want to add anything to that?
Beautiful. No, beautifully stated. And we make sure they're getting sufficient nutrition, right? So often when people are eating a diet that's really refined and processed, right? That junk food diet, they're missing so many important nutrients that are necessary for biotransformation and detoxification to occur. And so we want to make sure they're getting sufficient protein, they're getting sufficient micronutrients, they're getting sufficient phytonutrients to support detoxification.
I heard so often you hear patients tell you, but look, my oncologist said, I have cancer, I'm getting chemo anyway, just eat whatever you want.
Mm.
What do you think about that?
We know that's not true, and it's dangerous advice. And we often also really do, depending on the type of cancer somebody has and where they are in this whole process, we are using the fasting mimicking diet that Walter Longo has, has done a lot of research on, and many others, which is a puts somebody into ketosis around their treatment, depending on what kind of treatment they're getting, or if they're getting chemotherapy, it's a lower calorie period of time that helps create where the cancer cells can't go into ketosis, so they're at a disadvantage and they are more affected by the treatment. So we will be using that. But at our practice, we have at least 5 nutritionists. So every patient who comes in to see me not only sees me, but sees a nutritionist. And so there's a lot of uh, uh, good support there by a nutrition professional, which I think is really necessary when you're doing some of these advanced plans like a fasting mimicking diet around treatment.
What about exercise? Should they just like chill a little bit because they're going to have to go through chemo and radiation and just not exercise and do it later? Or
No, it's true. It's true. Like most research is showing that, people who exercise during treatment, they do better. We just have to meet them where they're at. And right, but getting outside, getting fresh air, moving, doing some strength training is all very supportive for the body. But then we go into the matrix and say, does somebody have an imbalance in their microbiome? Like for me, unfortunately, I was on birth control pills I'm sorry, not birth control pills. I was on those too, but that's another story. I was on antibiotics often from the age of like 5 to 16 because of urinary tract infections. And so my microbiome was a disaster, and my digestive system needed a lot of work. And so, that was definitely not helping my risk as well. And so that's an area that we will work on. We'll make sure that person is really eliminating, they're having good bowel movements. We work to rebalance the microbiome if we see the high beta-glucuronidase and other signs of imbalance. And then of course, as we were talking about earlier, the importance of supporting the detoxification system, helping lower toxic load, as well as all of those things we were just talking about earlier that support the detoxification system. Yeah, there's more
so
we
we
could talk
talked
about.
about
Yes.
evaluation, we talked diagnosis, we talked about evaluation. We went over how to evaluate some of these imbalances that can lead to it. And this is helpful for people that have breast cancer, that want to prevent breast cancer, that have recovered from breast cancer, so or in remission from breast cancer. This is helpful to all of them. Now, why don't we get into a little bit about how would you approach it? Now, of course, we talk about supplements. We know that supplements do not cure disease, but we do use supplements often in order to help rebalance the system at an individual basis. So from that aspect, how would you now, maybe we can go over some of these imbalances and maybe some of these supplements that you may want to try with them, with the disclaimer of when people are on chemo, they do have to look and see how those supplements may interact with some of their chemo and their protocols. Maybe at some point you can talk about how you navigate that. But insulin resistance. Give me some of your go-to supplements that you may try for somebody that you've determined they have insulin resistance.
Yeah. So, I mean, it's tough to like, because
I know,
everybody's
but
so
you got to have a
different, right?
favorite.
But what I will say is a couple of my favorites in general. I make sure, first of all, that somebody is vitamin D sufficient, because
Yes.
that is really important for their immune system, for
Yeah.
insulin sensitivity, for everything.
What level? What level do you shoot for? Because there's debate about that. The range
Yeah.
says 20 to 100 is normal. So you'll have people that are 30 and they're being told, "Oh no, your vitamin D is fine." Where I know for us in functional medicine, we're more like, go past 50." But what
Yeah.
about with breast cancer? Yeah, do you
Yeah,
have
I'm probably between that 50 and 75 is like my general place that I'm going.
Okay.
Um, and then And then my other favorite is sulforaphane. So like a sulforaphane capsule, it's got glucosinolates, which come from your cruciferous vegetables, with some maracinase, which creates sulforaphane. And sulforaphane is just a wonderful, as I said, comes from your cruciferous vegetables, but it helps the body produce glutathione. It actually feeds the microbiome. It's good for the microbiome and helps feed some good bacteria in the gut and lower inflammation. It's been found to epigenetically impact the tumor suppressor gene, and it helps with phase 2 detoxification. So it's kind of like one of my
It's
regular go-tos.
hits a whole bunch of angles, right? It hits a whole
It's
bunch
a
of
whole
angles.
bunch of angles, and most, when we're most oncologists, when somebody is going through treatment, they want us to avoid a lot of antioxidants. But I'm thinking more like a multivitamin with a lot of antioxidants in it, or glutathione on its own. Though
Yeah.
but I will use something like sulforaphane, and
Well, you can
even
do
when
it in
they're in treatment.
between. Like if they're getting chemo, you could. I know I've seen some practitioners say, "All right, stop them right before chemo for this many days," or
Yep,
like okay, do the chemo, eat healthy, exercise, and whatnot. All right, now this is your maintenance plan. Let's get you on the sulforaphane. Is that how you
absolutely.
do it, or are you?
Yes, it depends on
Okay.
this. It totally depends on the situation, but yes,
Yeah.
you can absolutely do that and really focus. If there is a lot of resistance for supplementation from the oncologist, you can really focus on lifestyle during that period of time. That's for sure.
And yes, we do personalized medicine, absolutely. And I'm going to look at the thing that will hit the most amount of or give us the most bang for our buck. So like if I have somebody that maybe has diabetic neuropathy, plus they have signs of oxidative stress, plus they have high sugar, I might put them on alpha lipoic acid, right? So because I'm
Yeah.
trying. But that being said, when I say insulin resistance, what supplement comes to mind? That doesn't mean that everybody should be on it. Like that's the disclaimer. What comes to mind with insulin resistance?
Well, honestly, the thing with insulin resistance is I feel that lifestyle, like we can do a lot with just lifestyle without a supplement, right?
Stronger. It's
But
stronger. Yeah.
yeah, but like if you're looking for one, like berberine, I think is really
Okay.
helpful. So
And that helps the gut too,
it
right?
does. But what I but the but my other go-to with women where we're looking to say, okay, what do we need to do from a breast cancer perspective is Asian mushrooms. So I will use some Asian mushroom blends to help support their natural killer cell production and their immune system functioning. So that's one of my other really good like go-to supplements as well in this situation.
Okay. And you kind of mentioned if beta glucuronidase is high, what supplement may help with that?
Calcium D-glucarate,
Right.
and that will help bind to the estrogen that was cleaved because of that high beta glucuronidase.
We are running out of time for this section. So we mentioned you love sulforaphane. What about iodine? Do you ever give iodine?
Yes, yes, I do sometimes give iodine. I measure 24-hour urine iodine. If it's low, I'm typically giving somewhere between 150 micrograms and 1,000 micrograms. I don't typically go to those high doses of iodine unless there's you know, like if people have a lot of breast tenderness, we may go up a little bit higher, but that's my typical.
Yeah, I sometimes I just put them on iodine and watch their thyroid so it doesn't become hyper, just because of the whole halide situation. So like
Yeah,
I remember reading that if iodine is needed in highly active tissue, and if the periodic table has the halides, which is bromide, chloride, fluoride, and iodide. And iodine looks very similar to the other three that are polluted in our environment. And what
true.
could be happening, like you'll see women with breast cancer and thyroid problems very often, and it could be that those environmental halides are going into the thyroid and into breast tissue, causing issues So sometimes I'll just just put them on kind of a smaller dose like you to bypass. They might have enough iodine, but they don't have enough because of the halide. So sometimes I do that as well. So iodine. What about melatonin?
Yeah, melatonin has really wonderful anti-cancerous properties in it. It lowers inflammation and oxidative stress. And of course, we know that when people have the right amount of melatonin, their immune system works better. So melatonin is definitely one that I will add in. Typical doses of melatonin are zero point 0.3 to 3 milligrams about an hour before bedtime for sleep. But there is some research, and we sometimes will, even use a higher dose melatonin for women from a cancer prevention perspective,
Okay.
like 10 milligrams or 20 even.
At the end of the show, we're going to talk more about your book because I think it's exciting. But what is the name of your book?
Breast wellness tools to prevent and heal from breast cancer.
Oh man, everybody needs to just go buy it really quick before it sells out. But that was a solid overview of this clinical topic. And now it is time for the section that we get to the real world experience, the thing that artificial intelligence can't tell you. We are going to kind of dig deep and pick your brain, and we are going to get into the clinical experience share.
To unlock additional premium content, including the deeper dive in this clinical topic, leadership and speaking tips, charting and efficiency pearls, and business mastery as a functional medicine practitioner champion, be sure to check out our mastermind and other membership programs at www.fmpessentials.com. Hey everyone, we hope you're enjoying the FMP Essentials show so far. Pretty amazing, isn't it? Remember, if you're part of our mastermind, don't miss out on our exclusive bonus clinical content. That's where we take a deeper dive look at personal experiences and real world insights that you can't just get from a book or from looking on AI. It's where we really get into the nuances that make a difference in your practice, the experience of the guest of our show. Thank you for watching, and we hope you enjoy the rest of the show.
All right, everybody, welcome back. Before we wrap up, we are going to talk about the seeds of the functional medicine tree. So if you think of the functional medicine practitioner as a tree, you have the trunk, which is knowledge. You have the roots, which is experience and wisdom. You have the branches, which is communication. Branches, which is leadership and outreach. You have the leaves, which is the interface and communication, and then we produce fruit, and that's the business. And then those fruit have seeds, and we want to plant seeds, and we want to work on. I believe that functional medicine practitioners are making the world a better place in many different aspects, and we believe that it is our obligation to make the world a better place. So before we get to that, Dr. Boham, thank you so much for everything you've shared with us so far. Let me ask you, what is it that you're excited about right now?
Well, I guess the thing I'm the most excited about is that my new book just came out, the updated version of the breast wellness tools to prevent and heal from breast cancer. It's so exciting to me because we've been working on it for a couple of years. My daughter's been editing the material for me, and we just got it as available as either an ebook or print on order through Amazon. And I'm really excited to get that information out there, about everything people can do to create this terrain where cancer is less likely to grow. So that's what I'm most excited about.
Awesome. And we will make sure that we put the link for it in our show notes. So for those of you that are interested, which should be pretty much everybody, make sure that you get a copy of that book. So we believe in giving back and making the world a better place. What are some impactful ways that you believe practitioners can contribute to their communities?
One of the things that I like to do the most, and that I would encourage everybody to do is to go out and give lectures and to talk and to the two different organizations in the community. It's just a wonderful way to give back and to have that interface with the community in a different way. It's also a great way to get more patients. So if you're looking for new patients, people come to hear you speak and they get excited and then they want to come and see you in person.
Nice. So going out there and just sharing your knowledge.
Yeah.
And you know what I found? I found in actually that's how I started as a speaker. I started by going and just giving community talks. I found some people, some practitioners, I think they make the mistake of trying to hold information so that you can come and see them in the visit. And I found you don't do that. You just give. Like you could have told me how many times you know what? That's in my book. You didn't, not once, because you're giving that information, and what
Yep.
that does is that makes me want to buy your book even more, right?
Hmm.
So no, thank you for that. I think that's solid advice. What about like donations, larger scale? Like I like donating to the Institute for Functional Medicine, the Environmental Work Group. Are there any organizations that you feel like we really want to be donating and supporting?
Yeah, I mean, I agree with you. I love to donate to IFM, so the Institute for Functional Medicine. I definitely donate to. I and that's probably my number one from the functional medicine perspective. I do donate to my university. I went to Cornell, and I really like to be involved in local organizations, both through whatever they need. So whether it's a lecture or money, so I work with the Hope Club in Latham, New York, which is the used to be a Gilda's club, and my mom spends a lot of time there, so I'll do lectures there periodically. There's another nice organization locally called Breast Cancer Options in the Hudson Valley. They do really good work and put out great information about breast cancer prevention and everything you can do. And they're a great organization I love to speak with. And then I love to speak at Kripalu as well. Kripalu is a wonderful local yoga retreat center, and I love to donate my time there. But financial donation, I love giving to IFM.
Awesome, awesome. Well, listen, one of, or probably our most valuable resource is our time, and you have been extremely generous with your time, and for that I thank you. I hope that you guys out there, this people really need to hear this. Please share this with your friends, with your family, with your practitioner. If you're a practitioner, start looking at how to be like us. We're pretty cool, aren't we? I think we're cool. Anyway, so how can practitioners stay connected with you and keep in contact with you?
Yeah, so I have a website, drboham.com. I'm also at the ultrawellnesscenter.com. That's where I practice in Lenox, Massachusetts. And on Instagram and Facebook, I'm Elizabeth Boham, MD. And on X, I think I'm Dr. Boham, something like that. But yeah, follow along.
Awesome. And send that all to us. We'll put it in the show notes. Thank you very much, Dr. Boham.
Thank you. Thank you so much, Yusuf. It's so great to be with you.
Hey everyone, I'm Dr. Yusuf Eliaman. We hope you enjoyed the show. For more exclusive content from this interview, check out our FMP Essentials Mastermind. Make sure you check out our website at www.fmpessentials.com for our blog and other content. If you enjoyed this show, please, please, please subscribe. Give us a like. It helps way more than you could imagine. Thank you for watching. Follow us across all social media platforms at FMP Essentials HQ. Please don't forget to share this with your practitioner friends, and we'll see you in the next episode.